Okay, so now we're going to kind of shift our focus over towards the white blood cells of the bloodstream and talk a little bit about the basics of their functions and kind of and the importance of understanding the individual cell types and the roles they play. Um, Basically, just briefly, we'll just kind of go over some numbers and then we'll kind of talk about how to differentiate between the different types of white blood cells and the roles that they individually play. Um, Now, first, when it comes to doing a white blood cell count, you'll see that. Remember, when we talked about red blood cells, we said that their normal levels are about, around with men, or give or take around 5 million cells per microliter. With women, maybe about 4.5 to 4 million cells per microliter, which is a lot. But when it comes to white blood cells, the number is drastically lower. As you can see here, with white blood cells, there's only about 5 to 10,000 cells per microliter of blood when you're doing a count. So as you can see, this is drastically lower than that of erythrocytes, and there's a reason for that. And that reason is that most white blood cells are, one, either have very, very short lifespans, and we turn them over at an extremely high rate, and two, the bigger reason is that white blood cells are made to be circulated and then stored in tissue. So a lot of the white blood cells you're going to actually see in the bloodstream are going to a tissue somewhere, okay, to be stored. Where there they have a much longer lifespan, unless we have an infection, and then they have to fight off the infection. We'll talk about that in a little bit. So the normal average white blood cell count again is 5 to 10,000 cells per microliter. Okay. Now, when it comes to understanding white blood cells, the white blood cells are a lot more diverse than platelets and erythrocytes. Okay, white blood cells we're going to also call leukocytes. Remember, leuko, Greek for white, site, cell. Okay. Now, basically, some of the differences between white blood cells and red blood cells is, one, they're larger. White blood cells on average are much larger than a circulating erythrocyte, and also the nucleus. White blood cells actually have a conspicuous nucleus, and that's important to understand because we're going to come back to that when we talk about differentiating the different types of white blood cells, because we'll talk about 5 major different types of white blood cells, but how do you tell them apart when you look at them under a microscope? And one of the major ways you do that is by looking at the shape of the nucleus. Okay, and you can tell a erythrocyte because they don't have a nucleus. All right. Now, when it comes to talking about these white blood cells, we said that the average number is 5 to 10,000 cells per microliter. Okay. Now, the function of white blood cells, as you know, their overall function is immunity. I mean, your white blood cells are the biggest constituent of your immune system. They're the ones that attack foreign invaders, whether it's a bacterium, a virus, an infectious protein. It could be just dead cellular debris. In pathologic situations, if someone has an autoimmune disease, your body recognizes one of your own tissues as foreign, and it's your white blood cells that attack that. So your white blood cells are designed to attack anything really that is recognized as foreign. Okay. Now, like I just said earlier, there are 5 different types of white blood cells, or the 5 major classes of white blood cells. Now the thing is, let's talk. How do you tell them apart? And one is by understanding their function, and two, again, is by looking at the morphological differences in the physical characteristics. Okay, but let's kind of talk about the importance of a differential white blood cell count. Okay, when we say differential, what we mean is we look at the white blood cells, and basically what we're doing is we're looking at the white blood cells when we look at it under a microscope. We know, you should know that there's a certain percentage of each type of white blood cell normally found in your blood. Okay, for example, as you can see listed up on the board here, you can see the neutrophils. There's about 50 to 70 percent of all the white blood cells you would normally find in a blood smear in a microscope would be neutrophils. Okay, with eosinophils it's 1 to 4%. With basophils it's usually 1% or less. Lymphocytes 20 to 40%, and monocytes around 1 to 6%. Okay, so we can see that we naturally find these white blood cells in different proportions in the blood. All right, and there are some reasons behind that, which we'll talk about in a little bit. But that plays a role in also understanding the functions of each type of white blood cell and the classes of these. All right, for example, neutrophils are white blood cells that are designed to attack, bacteria. They're nicknamed first responder cells. We think of them in a basic sense as going after bacteria and other small quick invaders in the body. So as a result, let's say you have some kind of a bacterial infection or a big cut in your skin, and you were to do your neutrophil count. The percentage of these, is normally 50 to 70%. Well, let's say now all of a sudden in that blood count it's 80%. Diagnostically, that's key because you can look at that and that can give you a direction to go when figuring out what's wrong with the person. Okay, eosinophils. Okay, eosinophils. I mean, with eosinophils and basophils, their functions aren't the best understood, but we can say that eosinophils, just in a general sense, go after parasites. Okay, probably the most common example of a parasite would be in a worm that invades your body. Whether it's through something you eat or it gets up through your skin, whatever it may be. Okay, so if we say normally with your eosinophil, the percentage of eosinophils in your blood is 1 to 4%. Now all of a sudden you're up to 15% eosinophils. That may be indicative of a parasite infection. Okay, like a worm or, like I said, some other example. All right, basophils. Okay, we use basophils for allergic reactions. Okay, allergic reactions and the controlled bleeding and things like that. Okay, and I shouldn't say controlled bleeding, to prevent clot formation. Okay, and so so let's say I do a blood count, and percentage of your basophils is up to 15-20%. That's gonna indicate maybe this person is having an allergic response to something. Okay, so that's why it's important to understand the different percentages of these, because like I said, when you do a differential count, all right, that'll give you a more specific direction to go when trying to figure out what's wrong with the person. With lymphocytes, these are cells that attack basically bad cells in the body, like cancer cells, virally infected cells, maybe single-celled invaders. Okay, just dying defective cells. Okay, lymphocytes go after these. So if you know the normal range of these in peripheral blood is 20 to 40%, and you do a count, and all of a sudden you see, oh well, they're up to 55%. That may indicate they have cancer. Okay, so or they may be fighting off a virus of some sort. All right, and monocytes, these are phagocytes. Okay, these are phagocytes. Again, if you see a high level of these, that's going to indicate something's going on, because where there's an infection and you're fighting it off, there's going to be tissue damage. You have to clean the debris. You have to phagocytize the foreign invaders and damaged material. All right, so that's why it's important to not only understand the normal levels of white blood cells in the blood, but to understand the differential counts that go, the normal percentages that go with these, that play into their functions. Because, like I said, if someone has a bacterial infection, a certain type of white blood cell neutrophils potentially can be elevated. If someone has cancer, lymphocytes may be elevated beyond their normal levels, and that can give you, like I said, a better direction to go. Okay, and I'll get more into the specific functions of these and physical characteristics in a little bit. All right. Now, the average lifespan of a white blood cell, we said red blood cells, give or take, stick around for about 120 days. And then they start to fall apart, their cytoskeleton starts to weaken, and then they can't, undergo tissue, they can't repair themselves, because without a nucleus and without DNA, they can't drive protein synthesis. So they go to the spleen, and then we basically break them down and recycle them. Now, with these white blood cells, their lifespans are very different depending on the cell type we're talking about, and also depending on where you find them, if they're in the blood or if they're in the tissues. Okay. First, let's talk about granulocytes. Now, granulocytes are a class of white blood cells that you're going to see when you look at them. Let's say here's a cell, and then you've got a nucleus. Okay. And a granulocyte is going to have these very large, fine granules in their cytoplasm. So when you stain them, like with a Wright stain, which we did in class, you can see these granules, the proteins in the stain stuck to the granules. So the cytoplasm has a really rough-looking appearance to it. And these first three types of white blood cells, neutrophils, eosinophils, and basophils, they're all granules. Okay, and again, I'll talk more in depth about these in a little bit. Okay, but those are granulocytes. Now, granulocytes in general tend to have a very short lifespan and high turnover rate. Okay, So granulocytes tend to only stick around in the blood for about 6 to 8 hours. Okay, 6 to 8 hours, which isn't long. So basically, one of the big reasons why is because these cells are, like for example, especially basophils, they're going to tissues. They're going to be stored in connective tissues and around capillary beds, so they can just hang out there until they're stimulated to do their job. Okay, some just don't last long in general, like neutrophils. If you have some kind of an infection and you need to migrate a bunch of neutrophils over to the area, like let's say you get a cut in your skin and bacteria is coming in, they're going to go in, they're just going to go in the tissue, they're going to kill the bacteria, and they're going to die in the process. Okay, so granulocytes just don't stick around for that long in the circulating blood. Like I said, they're migrating somewhere else. Okay, in the tissue, they tend to last, give or take, for about 2 to 3 days. So they do have a slightly longer lifespan, but again, they still don't stick around for long in general. So as a result, granulocytes have a very high turnover rate compared to the rest of the leukocytes. Monocytes circulating around in the blood kind of stick around for a little longer, 36 hours. Okay, they can stick around in the blood for up to 36 hours, and then once they actually migrate into a tissue, they can last as long as months to years. Okay, and again, that's going to depend. If there's an infection or tissue damage to a certain area, then the lifespan of these cells are going to be a lot shorter because after they're performing the work to fight something off, they will die. Okay. When it comes to T cells and B cells, those are your lymphocytes. Okay, those are your lymphocytes. And T cells kind of hang out in the blood for about 10 hours. And then again, once they get into tissues, they stick around for, days to years. Depends on what type of T cell we're talking about. And it just depends on, again, if they're fighting something off or not. Okay. Whereas B cells don't stick around in your blood for very long. Okay, a lot of people think that they're made in the liver and they migrate straight to lymphatic tissue. Same thing with T cells. I mean, we don't say the T cells are made in the liver, but these B cells, they're circulated right to lymphatic tissue. And again, they can kind of stick around for a while, but eventually what a B cell is going to do, which will go way more in depth than when we talk about the immune response, what B cells do is when we turn them on, they turn into a cell called a plasma cell. All a plasma cell is an antibody producing cell. So all they do is they turn into this big antibody producing machine. They crank out millions and millions of antibodies. They do this for a couple days and then they die. So again, the lifespan of a B cell just depends on if it's actually involved in fighting off an infection or not. And then platelets, just to kind of throw these in here, we turn our platelets over completely about every 10 days. Okay, we turn these over very quickly as well. All right, so these are just kind of some basic numbers that kind of go with your leukocytes. Now let's kind of talk about the physical characteristics of these, and let's talk about their functions that kind of go with them as well. All right, I'm going to leave these numbers up on the left here, the percentages, just so we can you can refer to these as I'm talking about them. Okay, now again, like I said before, when it comes to understanding white blood cells and identifying them, you have to really look at their physical characteristics, or morphological, as we say. All right, and like I said, there are two major classes of white blood cells. They're what are called granulocytes and agranulocytes. Okay, and Okay, again, when we say granulocytes and agranulocytes, what we're talking about is when you look at a cell, and when you stain in one of these white blood cells, and you look at them under a microscope, you're gonna, if they're granulocytes, they're gonna look like they have these big kind of sandpaper-like looking dots in their cytoplasm. And again, those are granules that store lytic enzymes and other chemicals that may be used to promote, breaking down of bacteria or anything else they phagocytize. It could be used to promote an allergic reaction, to prevent the blood clot. Okay, it just depends on what type of cell we're talking about and its function. Okay, so the three examples of the granulocytes, like I mentioned earlier, are the neutrophils, eosinophils, and basophils. Okay, now when we want to try to tell them apart, basically you have to look at the nucleus. Okay, you have to look at they're all three of them are in the same class. So you have to look at the nucleus and you have to look at the granules. Okay. First, when we look at neutrophils,